Hello, welcome again to today's lecture. We are doing the second part of the communication skills. Okay, and for today, we're looking at communication types. Now, when we talk about communication types, we are going to be discussing, as we said earlier, the major types of communication. Now, this doesn't necessarily mean that we can choose one, but in combining those two communication types, it gives our patient, okay, our customers, an excellent understanding of the message we intend to send. So there are two main types of this communication. The first one is called verbal communication, and the second is a non-verbal communication. Now, under verbal communication, we'll be looking at written, okay, writing letters, sending emails, chatting on WhatsApp, Facebook. That all is part of written. Then we have the oral communication, okay, the things we say, including speaking, listening, and questioning skills. Now, under the non-verbal communication, we're looking at body language. Normally, see it is wordless, okay, and it involves our eye contacts, our facial expressions, hand gestures, grooming, dressing, space that we leave between us and somebody, the tone of our voice, our posture, and touch. As I said earlier on, for us to be able to communicate effectively, okay, we are supposed to combine every aspect. This was said by Dr. Albert, and he said that we have the non-verbals and the vocal elements. Okay, that's the verbal plus the words that we say, and all this to give us 100%. Now, if you look at the word, that's the verbal communication, is forming only 7%. But look at the characteristics of your voice, your pitch, how high or low you speak, inflection or your tonation, okay, the speed at which you speak, okay, the volume of your voice, whether it's low or high, the intonation, okay, and the rhythm gives 38% of meaning to the word. Now our gestures, okay, our facial expression, our hand gestures, and etc., give 55%. So for us to be able to communicate effectively, we should combine all. So assuming a patient comes to our pharmacy with a severe condition, let's say hypertension, and I want to communicate to the patient that hypertension is a condition that she's going to manage for life. Depending on how I say this sentence could mean a lot to the patient. All right. So if I want to say, oh, madam, hypertension is a condition that you'll be managing for the rest of your life. Okay. That one is different from where I speak with a high tone, like, hey, madam, hypertension is a condition you're going to manage for life. Oh. See, these two sentences give different meaning. In fact, the last one I just said was with a high pitch and I increase the speed. Normally, it will alarm the patient. In fact, their blood pressure is even going to go very high at the pharmacy before they leave. But assuming I reduce my pitch and the tone, I reduce the speed, and I said, madam, please, hypertension normally is going to be managed for life. The patient is no more alarmed when I speak with a high tone. And normally, when we start the lecture into details, I'll be showing you some of the gestures that we should be avoiding at our pharmacy. When it comes to the first type of communication, that's a verbal communication. Okay, it's a communication involving the use of words, both spoken and written. Quality communication requires much more than the giving of information. Okay, we are not just worried about just giving information, but we are going to be worried about the full scope of skills of listening. Okay, when somebody is speaking, we should have the attention span. We should be able to concentrate on what the person is saying so that we follow. When the patient walks into our pharmacy and is coming to complain of a disease or is asking of something, we have to listen very well. In listening very well, we're able to comprehend, that is, understand the information the patient is giving, then imparting that information to others, okay, obtaining feedback, whether we have understood or not, as we talked about in our previous lecture. Feedback helps us to validate that the information was received accurately and fully, okay, and also documenting the fact that each step in the process of communication was followed, okay, and that is why in the verbal communication it is important that these things are respected. If we let go any of these things, it will normally affect on the quality of information that we are sending to our patient. Verbal communication consists of much more than words, that we said, the tone that you use, all right? So we could have somebody that could use a tone that could be serious. For example, if somebody say, I love you, all right, and the person said it in a junior, oh, see that I love you. It's different from somebody looking and says, I love you. Okay, the tone of speaking will change the meaning of the words. Inflection, okay, how the tonation went, all right, the level of pitch, okay, whether it's a high pitch or a low pitch. Okay, high pitch is where you are speaking like I love you. Okay, that is a high pitch. Okay, that is alarming. When you want to say I love you, I don't think any of us, any of the guys or a lady will tell somebody, oh sweetheart, I love you. That is alarming. The person say, Charlie, breathe. All right. So in talking about that, we go to a low pitch, say I love you. That's a beautiful pitch, okay, to express the message of concern and calmness. So the meaning of the message we are sending even means more than the words we choose. Okay, sometimes the words we choose will not mean more than the inflection, the level of the pitch that has been attached. Proper diction. When you talk about diction, we are talking about more of pronunciation. Okay, how the words are pronounced, and enunciation. Enunciation has to do with how the accents that are used. Okay, for example, sometimes I want to like the British, we would normally say I'm going to bath, or have you taken your bath? Okay, have you taken your bath? Some people will say that have you taken, or I'm going to bathe instead of bath. Okay, I know for us we're not going to worry so much about it, but sometimes you may be working in a pharmacy and you have somebody walking into the pronunciation, like for example, the word calcium. Some of us will say calcium, but people will say calcium. All right, so this diction and enunciation may vary from, but it could mean something different altogether. All right, so the way we pronounce certain words could mean, for example, that you are serious or you are not serious, okay, or you are schooled or you are not schooled, okay. So there's a way we pronounce, and that one gives a lot of meaning to the words we pronounce. If somebody would want to say the word, let's say Yvonne, we know that Yvonne starts with Y, and the person's saying that in the pharmacy, in the hospital pharmacy, you are mentioning the name of the patient on the prescription and say why Yvonne. I think everybody will look at you and say, why destroy somebody's name? Even though it's starting with Y, the diction will say that we say Yvonne. Okay. Quality communication requires that in giving information, we are able to also listen, okay, as we talked about it already. Now, in listening skills, okay, some of the things that we are going to be talking about in listening skills is the ability to accurately receive and interpret message in the communication process. Your ability to be able to receive accurately and interpret the message. We then will say that we listen. In fact, after listening, we are going to talk about questioning. When I'm listening and I don't understand what somebody is saying, I ask questions. Normally, when people don't listen, they are not able to ask, in quote, intelligent questions. For example, assuming I'm giving a lecture and a student is listening and they want to ask a question, they are able to ask accurate question. They'll say, Mr. McQueen, you said ABCD. Could you explain what it was meant by that? That is better because I know the patient, the patient, the student was listening. Than the student that to say, sir, please, I have a question. What is the question? Sir, please, I don't understand everything that you have taught. Okay, that will tell me that the person or the student really wasn't listening to my lecture. And that is why after going through the whole communication process, that student may not have understood. So listening is key to all effective communications. So far as we want to communicate and understand people, we should have the patience of listening. Sometimes we think the patient is boring, but hey, that's the work we are doing. We should have time for our patients. And I hope you remember our motto, Amicus Humani Generis, friends of the human race. Okay, friends of the human race. We want to listen and we want to let the patient know that we are giving full attention to them. Without the ability to listen effectively, messages are easily misunderstood. Okay, if you don't look at the person, if you don't monitor them as they talk, okay, so listening doesn't just mean hearing. Listening means that you watch them with our eye. Okay, look at the people, use your eyes to show that you are listening. Okay, turn off any negative thoughts about the person. Okay, for example, if I'm lecturing, somebody can have a negative thought. Okay, oh, this man, for those of you who don't know me, maybe you will see me. If you look at how come that this pharmacist is short like that? So as I'm lecturing, you have a negative thought. Or how come that this man did not say hi to me? Or how come this man said ABCD? That is negative thought, and that once you go on that negative thought, okay, you tend to go on what you call a memory lane. In a memory lane, you are thinking and thinking and thinking and thinking. Okay, so for us guys in the pharmacy, you could have a very pretty lady walking into the pharmacy with all the curves, all right. Then you look at it and say, wow, this girl is fine. I wish she was my girlfriend. I want to propose to her. And this patient is standing in front of you and telling you a complaint she has gotten. That's a negative thought, okay? And that will not allow you to listen effectively to people. When you also listen, you want to lean towards the people, lean towards the person. The person means that you are you if you are seated, okay, you don't relax in the chair, you just try to sit upright and lean towards. When you lean towards somebody, okay, it means that you are more interested in what they are saying. Also, start listening with the first word and listen attentively. Some of us, especially on telephone calls, we may not listen very well. We miss the beginning of the talking, the conversation, midway. Then want to pay attention. And it's like we are lost. And sometimes it's quite embarrassing to ask the client, to ask the patient that, Madam, please, can you start all over again? Okay, and normally when you do that, you are going to be misinformed, and obviously you are going to give the wrong message. So assuming the patient walk inside and the patient is talking to you, and all that he heard is that, oh, I saw blood in my panties. Now you're not confused. But as you are listening, the patient might have started that, oh, I think I'm pregnant for some time. I'm pregnant. Okay, I've gone to the hospital, and this morning when I woke up, I saw blood. Okay, but if you did not listen to the first part about the pregnancy and you just said about I saw blood, possibly you may tell the patient, oh madam, I think it's your menses. And she's going to say, I'm pregnant. Are you saying I'm menstruating? And I say, oh, sorry, please, I did not hear that part. That is quite embarrassing. I think we should be able to avoid all. So listen with the first word. Pay attention. Once somebody walks into the pharmacy, please let's give them our full attention right from when they start to speak to they leave to the pharmacy. Okay. Also think at the speed they are talking. Do not jump ahead. Sometimes they could be slow, sometimes they could be stammering. Okay, and we want to be able to, because we think that they are wasting their time. So hello, good evening, please. I want to buy this medicine we use for children. This painkiller. To price time or price time. Madam, yes. What can I do? When we start to talk like that, it means that we don't want to listen to the patient. Sometimes some of us have even complained when we go to the hospital that by the time you finish telling the doctor your complaint, he has already finished writing your prescription for you. Then you are like, whoa, did he really listen to my issues, or he just jumped to write me a prescription? Also, when some people are talking, okay, we tend to interrupt them. Do not interrupt or make comments or give opinions when somebody is talking. Wait for the person to finish before, if you have any question, you will. By somebody is talking and you interrupt them, or a patient comes and say, oh, yesterday when I was in the room and the earthquake happened, then we jump, yes, me too, the earthquake happened. It was shaking my windows and blah, 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 blah. We don't do that. Let the patient finish. Yesterday, when I was in the room and the earthquake happened, I hit my head against the wall. Could you please help me with some pain relief? Okay, so yeah, the patient have made a point that it's the pain started during the time of the earthquake, and he hits his head against the wall. But if you are not patient, you the MC will jump and say, yeah, me too, it happened with that earthquake that happened, and the patient may be annoyed because you've interrupted them, you've not allowed them to finish. Especially, you see, in communication, if you don't wait for people to finish speaking, you always misjudge them. If you don't wait for people to finish, you can see a beautiful lady, and I say, wow, madam, you are beautiful. They say, hey, young man, please, I am married. But you see, assuming she waited for me to finish speaking, I say, madam, you are really beautiful. I appreciate the handiwork of God. I appreciate the way you dress. God bless you for that. All right. Maybe after finishing speaking, after I finished speaking, I might have made sense, and this person might not have interrupted. Or somebody say, "Hey, stupid!" They say, "Hey, are you instructing me?" The person, no. I'm saying, "Hey, stupid cow or stupid dog." Okay, the dog beside you, but I'm not referring to you. That could be quite embarrassing. So do not interrupt or make comments or give opinions when somebody is speaking. Wait, okay, that's very intelligent and wise. Wait for them to finish speaking. If there's anything you don't understand, if they are asking for comments or opinions, okay, that is when you come in. All right. Most customers just want you to listen to them. Okay, they just want you to listen to what they have to say. Okay, and sometimes a lot of people are healed when they just listen to you speak. Also, when it comes to listening, it is important to take key notes, okay? Key notes so that you can repeat back to what the customer said. Sometimes it's important, and this one tells the customer that we are listening. The example that I use, oh, boss, yesterday during the earthquake, I hit my head against the wall and it's really hurting. And so, oh, sir, sorry, did you say that you hit your wall against the wall and it's really hurting? Is that what you want to tell me and you want me to say? Yes, yes, that's what I'll say. You call this one paraphrasing, okay? When you're listening to people, sometimes when they give the opportunity to talk, if you're able to paraphrase them before you talk or ask them question, they are interested to that, wow, he or she really listening to me. All right. So you nod in agreement when you are listening to use your facial expressions and body language to show you understand what they are saying. Okay, and I love the Nigerians for that, especially in their movie. When you watch, you can see the way they fold their arms, they are not the way they do all those things, shows that they are listening. Ask close questions when the person has finished talking so you can check your understanding of what has been said. And when we continue the lecture, I'm talking about closed and open questions. Closed questions normally are questions with the answer yes and no. Madam, please, did you say you hit your head against the wall? The patient may say, yes, I did, or no, I did not say that. All right, so that's what we call a closed question. Okay, so closed question will let you quickly be able to check whether you have understood what the patient said. Also use the patient's name, if you, especially when you know them, when you are speaking with them. Okay, use their name and use you a lot when you are checking and say, you said, madam, you said that, madam, you mean that, madam, or if you know Mr. Bequin, are you saying that? Okay, that's one let the patient normally forms a type of rapport, a connection between you and the patient. Also on the phone, okay, when you're speaking on the phone, like the beautiful lady can see in the square that's speaking, there's something we call verbal noises. Because when you are speaking on the phone, I can see you. You can use these verbal noises whilst you are on the phone to demonstrate to the person on the other hand that you are really listening. And it shows you are interested, okay, without interrupting them during their flow. So assuming you're on the call with me and we are talking, I'll be giving you verbal noise like, oh, okay, oh, is that so? Oh, I see. Oh, sorry. What I'm doing is called verbal noises. It just lets you know that I am following what you are talking about. Okay, so that is called a verbal. So on the phone, we can use verbal noises to demonstrate to the patient that we are really listening to them. Now, the next one is questioning. I said that if you're able to listen very well, you can ask beautiful question. Now, in the pharmacy, certain questions are normally asked to encourage the listener to provide more information. Mind you, the law says that we should be careful. Not everybody that walks into a pharmacy should be given a medicine. And how do you know who to give and who not to give? We can only do that by asking questions. There are two main types of these questions. Okay, the first one is called the closed question, and the second one is called the open question. Okay, so one of the most effective ways of getting a customer to talk and to establish their needs, okay, and what they are expecting is to ask questions. All right. Now let's look at the open questions. Open questions normally are sentences that will start with the 5WH, as I want to call it, 5WH. Okay, so it's who is the medicine for? Madam, please, who is the medicine for? Who are you buying the medicine for? Oh, it's for my dad, it's for my father, it's for my son, it's for my wife. Okay, what is wrong with the child? Okay, now these questions make the patient talk. Oh, when he came back to school, I saw he was running a temperature. Oh, okay. Another one could be why. Why do you think that your child is not eating? Is there any problem with the child? Oh, I think that he's not eating because he has been running some temperature for some time. Okay. Or where did this happen? Where did this happen? Where did you fall? Or when did this happen to know our time? Or how did it happen? All right. So it is very important that in the pharmacy, so for open questions, one of the most useful styles of questioning is an open question. And by using open questions, you'll be able to find out more information during the conversation. Okay, open questions encourage people to open up about their thoughts and feelings, and it's important that the pharmacy we use more open questions to allow people to tell us more. In fact, the more a client is able to tell about their health condition, the more better we are able to help them identify the possible causes and the treatment options available. Examples of open question like what type or types of dewormer are you looking for? All right. For example, somebody wants a dewormer that is flavored. Somebody wants a dewormer that's only one in a pack. What made you come to this salon to have your hair done or your hair cut? Okay, like somebody goes to a hairdresser shop for the first time, that question can be asked, or why did you choose this pharmacy? Okay, this type of questions normally allows the client to throw more, okay, on what they are thinking and what they are feeling about a service or a product. So it's important that when a patient comes to our pharmacy, we ask who is the medicine for? Okay, who are you going to give the medicine for? What are the symptoms? Okay, so these are the open questions. So for a patient to come to our pharmacy, it is important for us to understand this. For the closed questions, as we said earlier, this type of questioning encourages a short, specific answer, normally a yes or no. Okay, so normally, for example, closed questions are also a good way for you to check that you have the right information and you fully understand it. All right, so examples of closed question: is this the medicine you want? Obviously, the answer is going to be yes or no. Did you say that you want Panadol, sir? The answer will either be yes or no. So the medicine should be delivered to your house. Is that right, madam? The answer is yes or no. And the last one, is there anything else that you require beside this? The answer will be yes or no. And in fact, aside this one, when we start model 3, we'll be discussing more about prescriptions, okay? And one of the things that we do when we receive a prescription, in fact, the first thing that we do is to check whether the prescription is correct. And we can also use closed questions. For example, if a prescription comes bearing the name Marbequin, before we serve, we want to be sure that the bearer of the prescription has gotten has gotten the same name. All right. So assuming I walk inside your pharmacy with a prescription with my name on it, Marbequin, you can still ask a closed question. Okay, sir, please, are you Marbequin? The answer will be yes or no. Okay. So closed questions are very, very important for us to know the right information and for us to fully be able to help the patient with it. Now, remember to avoid asking too many questions, okay, close together. Sometimes when we ask a question, we don't give the person we asked the question an opportunity to answer. We say there are a series of questions that can see that are being asked, okay. Now, once you do that, you frustrate the client because before they answer a question, you're already asking another question. So importantly, questions should help you when listening as you can use them to check your understanding of what the customer is saying. Use them wisely and they will be very helpful to you, okay? But do not bombard the customer with a lot of questions. That sometimes is even unnecessary. For example, the patient walks into your pharmacy, a lady walks into your pharmacy and is buying a Lydia contraceptive, okay, a Lydia contraceptive. One of the questions I think would not be right for you to, because you ask the question, Madam, please, are you going to use the medicine yourself? Okay, so some of these questions are there that we don't ask. Or is the man that you are going to have the intercourse with, that man your husband? Okay, these are questions that customers will consider to be stupid questions that we don't even ask. All right, so the ability to ask the right questions is the single most important skills. Please know when and where to ask this question. It's very, very important that we get this skill. Or majority of the work we'll be doing in the pharmacy will be dependent on our ability to ask salient questions. In fact, there are days that patients even want to lie to you. All right, but your questioning skills will prove that you are matured and you'll be able to deal with any case that is being presented to you at the pharmacy. Now, the next thing under the verbal communication, as we said earlier, is the written communication. Excellent communication skills are also important in the pharmacy setting, and the MC should be concerned about his or her writing, okay? In as much as possible, the clients are concerned. One of the things that is very important about our writing is that we are supposed to write legibly. Legibly means that we write so that somebody can read. Sometimes our writings are very, very bad, okay? Doctors or some of us may write labels and patient can't even read. Inaccurate or confusing writing in the pharmacy setting not only irritates others but also may lead to harmful patient care. In fact, one of the things that I've always been saying, and as I said, when you start calculations, we're talking about prescription, is where we are labeling a medicine and we tell the patient take one tablet 3 times a day, and normally we write 1 times 3 on the envelope. That is very bad written communication. It is best that instead of us to take one tablet 3 times a day, we rather tell the patient to take one tablet every 8 hours. Okay, because we have 24 hours a day. If you are taking a medicine 3 times a day, basically it means that you take the medicine every 8 hours. Or assuming a patient is taking the medicine twice a day, it's better for us to communicate in written, write on the envelope, take your medicine every 12 hours, or better still, take your morning 7 in the morning and 7 p.m. at night, okay? And that is twice a day still, but here you are specific, 7 a.m. and 7 p.m. The MCA will often be responsible for many kinds of writing, including memos, email messages, ordering supplies, and recording keeping or record keeping. Sorry. So assuming you are sending a memo to all the staff about a meeting, and for example, your writing is inaccurate or is confusing, you just write that there is going to be a meeting on the 30th of June. That is very confusing because what time would the meeting be? Where is going to be the venue? Possibly what is going to be discussed? What is the agenda so that people can prepare? Okay, so in sending memos normally are internal communication. It doesn't go out. It's for the staff that we work in one pharmacy, or sending email messages as we do for assignments. And I always say you are supposed to, and a lot of you are doing very well in communicating with me on the email and your WhatsApp pages. Okay, so when you are communicating, then what you want, it should be specific so that when I'm answering, I'll be able to give you a correct answer. All right, or you are placing an order from a company, so you want to buy paracetamol 500 milligram, but I just wrote paracetamol without writing the strength. Okay, the strength is the amount of active ingredient in the medicine. All right, written communication can reinforce or back up oral instructions or explanations of possible side effects of medications and can clarify misunderstandings to others. In fact, in the pharmacy, even though that we will counsel a patient and advise a patient about the medicine, it is important that any important information that possibly might cause serious damage or have serious side effects on our patient is also written on the envelope. So assuming that a lady is buying a contraceptive, let's say Lydia, contraceptive normally does not go hand in hand with antibiotics, okay, oral contraceptives. When somebody is buying secure an oral contraceptive and they are taking an antibiotic, normally the antibiotic will not allow the contraceptive to work. So after telling the patient that, madam, please, as you are taking this contraceptive, if you are on antibiotic, use another form of contraceptive. For example, add a condom or something. We can write it on the envelope so that in case they forget, the written communication has reinforced our oral instruction explanation that we gave to our client. One of the things that is important that we also do very well when we are talking about communication. Okay, one of the very most important things that we are going to do is what we call the non-verbal communication. Non-verbal communication. Now look at the picture I've posted. You could see they are pusher and sitting. Obviously, you can see if it's a meeting, they are bored, either they are tired, the guy there wants to stretch, one is putting his head on the table sleeping, another one is reading or seems to be doing something. Okay, now assuming you walk into a room and have these four people seated, they have communicated to you that they are tired. Really, they want to go home. One is sleeping, one is stretching. The lady seems not to be concentrating too much. So assuming you are giving a presentation, these people have called you, maybe you are selling a product, and they've asked you to come and talk to us. And as you are talking, okay, as you stand before them and you are talking, this is what they are showing you. Even though they be so, don't worry, you talk, we are listening. The posture they are showing you tells you that, master, you should stop it because they are not interested in what you are doing. That is the power of non-verbal communication. It speaks more than the words. Even if they say that, oh, we are listening to you talk, their body posture, okay, is telling you that they are not listening to you. So by far, most of our communicative transmissions are non-verbal. And non-verbal, normally, I say it is we express it consciously and subconsciously through what is known as body language. Sometimes when you are tired, by the time you realize you are yawning, okay, or you are sleeping, there's nothing you can do about it. All right. So we say that that one normally is unconsciously done, or somebody slips and you laugh. Okay, sometimes it's unconscious. By the time you realize the person is taking it serious, like it means you are happy that I've fallen or I fell down. Maybe you are not happy, but it was funny. Okay, but the non-verbal communication has communicated more than the words. Body language, when you talk about that, involves your eye contact, maintaining eye contact with the person you are speaking with, your facial expressions, your hand gestures, your grooming, your dress, space, tone of voice, and your posture, okay, touch, and other things like that, okay. So, for example, let's talk about the eye contact. Maintaining good eye contact is the most important nonverbal communication skill. It imparts to the receiver the impression that one is indeed interested in and paying attention to him or her. So when somebody is speaking, like the picture you can see, if you are looking up or down, it tells them that you are not interested. So we maintain eye contact. They look straight into the person's eye when we are discussing them. Anyone coming to a pharmacy rightly believes that he or she automatically deserves the undivided attention of the MC for the duration of the transaction. Okay, so with direct eye contact, the MC is conveying to the client that he or she is indeed receiving an undivided attention. Now, if a patient comes to a pharmacy and the patient wants to get your attention, and let's say you are looking at something else. Sometimes you are cleaning the shelf, or you are reading something on your phone, or you are watching television. This patient is talking. Without maintaining good eye contact, the patient knew that he or she is not welcome to the pharmacy, and some will be irritated and walk off from your pharmacy. Okay, eye contact is not comparable to staring, okay, which is impolite and invasive. Okay, if you can see the picture, the guy sitting there is staring at the other person. This is not eye contact. This is not what I'm talking about. Staring is very rude. Okay, so conversely, the MC needs to be aware of the possible adverse effect that eye contact can create when interacting with individuals coming from different cultures who believe that looking directly at someone's face is rude and invasive. Okay, there are some cultures that if the person is an elderly person, especially where they think you've done something wrong, okay, so there's a problem in your pharmacy, your boss calls you and is asking you about it, that there has been some pilfering, somebody have stolen something in the pharmacy, a drug or something, or money, and they are asking you the question that, what happened? Did you steal the money? In our culture, if you are looking straight in your boss's eye while talking, he may say that is rude, that you are arrogant. Okay, so we should be selective depending on the situation, whether to maintain. Okay, sometimes just looking down may show a sign that you are sorry. If you do something and your parents calls you to scorn you, okay, just looking down, let them know that you are sorry. All right. So by being sensitive and attentive, the MC should be able to modify his or her approach accordingly, whether to maintain the eye contact or whether to stay off, not to maintain it, look away for some time and come back again. Depends on the situation and the culture in which you find yourself. All right, there are some other cultures and tribes in Ghana that you don't even look at the person. Okay, like some parts of the northern region, you have to bow and look down. Okay, that is a sign of respect. But if you look straight in the person's eye, that may be considered as staring. Okay, so staring is rarely, if ever, eye to eye contact, and it's often, as I've said, perceived as communicating a judgmental and negative message, if not an openly aggressive one. And somebody may think they are planning something bad. So let's maintain eye contact, but please let's not stare. And as I've said, it depends on the culture. Some culture, if you do it, they may think you are arrogant. Some culture, if you do it, they will think that you are good. So depending on where you find yourself when you are working, please use it appropriately. Another one is facial expression. In fact, our face talks a lot about us. Facial expressions that accompany direct eye contact can either reinforce or dispel a patient's preconceived fears. See, when people are coming to the pharmacy, let's be very frank, for the first time, they don't know it. A lot of them um, 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 feel embarrassed. For example, a lady coming to your pharmacy with white, okay, and there's a guy there. Normally she's embarrassed to even talk with you. Okay, they have a self-consciousness. They also have sometimes a decreased self-esteem, okay, and fear of being dehumanized by medical professions. Okay, like if you go and see a gynecologist and the lady would have to strip naked and lie down. Okay, she's worried about what the gynecologist would think of her. All right, because the gynecologist is seeing her nakedness. All right, so for us as MCs, okay, we should and we must demonstrate professional interest in the patient as well as care and concern. All right. Assuming the patient shows you something, maybe she comes and says, "Oh, I'm having a problem. I want to show it to you." You say, "Madam, please, what's the problem?" "Oh, I wanted to check something on my teeth. Okay, I have a gum swelling." You look at the teeth and you look shocked. You open your mouth, say, "Wow." Or you're judgmental. The way you look, the way your face turns, or disapproving. Sometimes there's a bad odor, so you want to hold your nose, okay, or you want to look away, okay, or disbelieving attitude, okay, are most exclusively conveyed non-verbally through facial actions. Okay, sometimes you have not seen the patient's mouth is smelling, but just by turning your head away or covering your nose with an handkerchief tells the patient that he or she smells. Okay, and body language in general, and under no circumstances are they appropriate behavioral attitudes to be demonstrated in professional settings. All right, so looking shocked, judgmental, disapproving, disbelieving attitudes, we are not supposed to use it in the pharmacy. Now, let's look at this lady. Okay, there are four facial expressions. For me, I'll go for the middle two. Okay, the first one is too cold. Normally, say you are cold because you are not as she's not the first picture. Okay, on your extreme left, it's not showing any motion. The extreme right picture, this person is laughing. Well, if something's funny, fine. But normally, when a client walk into a pharmacy, okay, between the two, the first and the second one is a business-like smile, one is a genuine smile. Okay, the genuine smile, that's what they are showing their teeth. Okay, the business-like one, that's why she's still smiling, but I cannot see the teeth. That should be your face anytime a patient enters. Whether the patient is smelling or not, whether what they are showing is disgusting or not. Sometimes they'll take a picture of their private parts and stuff like that. It may look disgusting, but you don't show that on your face, okay? Because you are a professional, you are an MCA. So our face expresses a lot about the emotions and what we are thinking. Another one is the hand gestures. Okay, in fact, the hand can be moved in various directions and can project a strong nonverbal message. Primarily, the hands are used to emphasize important aspects of words being said by the sender. So, like starting from the first one, we see the man with the two arms open normally is welcoming somebody. When somebody comes and we are welcoming, we open our arms. Even children I have gotten a beautiful baby. And normally when I get home, even this child, 1 year old, stretches and opens his arm. That's a sign that, oh, daddy, you are welcome. Okay. So when somebody comes to your pharmacy and this is a client that you already know, enters your pharmacy after some long time, so hello, Mr. Simesi, you're welcome with the two arms open. That's a beautiful gesture. Okay. The second one with the lady covering the nose is sometimes a shock of embarrassment or shock, and that could be negative. Unless, of course, the patient comes and say, "Oh, sweetheart, I just lost my wife yesterday." You may use your hands to cover your face as you cry. Say, "Oh, sorry." Okay, that is allowed. Okay, but you don't do that when you have seen something and you think it's disgusting. Okay, the third one is the arms fist. Okay, and this one is an aggressive sign. Okay, it shows you want to fight with your hands clenched like that. Okay, the two arms clenched. It means you want to box somebody. Okay, so that is an aggressive sign. When the client see you forming, as we may say in our own language, you form a blow. Okay, you want to give the customer a blow. Okay, that's an aggressive sign. If you're asking somebody why with the two hands open, like what the lady is showing us on the extreme right, why the two arms are open? Okay, the other one to down on the left, you can see the man raising the two arms going there. That normally is to accept an appreciation, okay, or recognition. Okay, normally when you go for programs and people are recognizing us, we raise our hands. It's different from the welcoming where the hands are normally straight. In accepting praise and all those things, our hands are raised. The other one is a sign of service. For example, at your service, okay. So there's a bow and the arms show a direction to where you want the person to go. So this one is a sign to show that you have appreciated it, you have accepted, you are honored, okay, and that's what you do as a service. With somebody kneeling down with their hands holding, normally it's a sign of frustration. There's a clap, there's a wave, as you can see. Okay, so various one. Okay, if your hands is at your jaw, you are thinking. Okay, if sometimes you are tapping your hands at the jaw, you want to make a decision. Okay, so various things can be used. Okay, to show various types of communication. Now, these are other ones that I think you know, so we just go through quickly. This the first one is excellent, and a lot of us that uses WhatsApp and Facebook have seen these signs a lot. Okay, with the thumb and the first finger forming a ring, and the rest show it a sign of something excellent. The two thumbs up, as we always call the thumbs up as a method of accepting. Okay, that is good. If a patient does something good, you can give it a thumb up. Oh, Charlie, good. Hello, Mr. Stemeni. Excellent. You finished taking your medicine. That is perfect. Okay. Now, folding the arms is a negative sign, by the way. It's something that we don't encourage. Okay. You should not be folding your arms as you are talking with the patient. Okay. That is negative. All right. Then we have others that's, I think you know already. Pointing your hands away. Okay. Pointing your hands, covering your mouths. Okay, you can know what these various hand gestures mean. Okay, somebody showing they are worried and all those things. Okay, so all these are types of hand gestures that we should avoid. We should avoid, and some we can use. The next one is grooming and dressing. That is also, and in fact, your appearance is an integral part of nonverbal communication. It influences the way others view us and can present a conflicting message or even a totally incorrect message. And when we see someone who is dressed or well groomed in a way that is very different from our own style, we assume that our personalities are the opposite. This is not always true, by the way. But although we should not judge people by the way they dress or how they are groomed, it is important not to form opinions based on what we see. You see, but a lot of time our patients will form for example, let's look at this person's fingernails. You can see the fingernails is grown, some are dirty. We don't do this in the pharmacy. People may see you in a different light that you are not well groomed. If in grooming, we keep our fingernails well clipped and manicured. Okay, then we remove any dirt from inside. All right, so this one will show to your client that you are quite dirty. You don't keep very good personal hygiene because your fingernails are overgrown. Okay, look at this lady. Perfect example. Check her dressing, her hairstyle. Her hair have been tied in a pony fashion, and that one demonstrates that she's the working type. She doesn't have the fabulous plenty hair like a queen. Okay, that hair tells you you're not ready to work. This hair tells you you are ready to work. Check her face. Her facial expression is perfect. Check her teeth. Beautiful. Check her makeup. Little makeup. Check her lips. Okay, it's not painted red lips. Okay, check her fingernails. Well groomed. Check her dress. This is a perfect example of how we should look. It's a nice groomed lady. You can see she's not wearing nails. She's not having any tattoo on her skin. Okay, she's not having any big and obvious earring. She's not wearing a necklace or a choker necklace. This lady obviously has not have a pierced nose or having a pierced tongue or a pierced lip as some people are doing. Nothing. Every MC should look like this lady. That should be your goal. Please dress officially. The schools, obviously, when you finish, you'll be having uniforms. Your uniform should be well ironed, okay? And should smell fresh. It should be neat. Your hair should be well kept, okay? You don't have loose hair and with a lot of dandruff, okay? This communicates. Any patient that walks into a pharmacy and sees an MC like that has absolute confidence in you that you are good, all right? Look at this guy too. Excellent. Look at the flying tie. Look at his haircut. Neat. Okay. He's clean shaved. His dresses is nice and everything is perfect. All right. So grooming in the pharmacy is important. Please, you can't wear anything to the pharmacy. I want to stress. Please, you can't wear any dress at all to the pharmacy. You wear an official dress. You wear a shoe You don't wear slippers or chaliwati to the pharmacy. You don't wear tattered jeans. Okay, the ladies, you don't wear stuffed jeans and your backside is showing, your breast is showing. Some are not even wearing braziers and their nipples are showing in the dress. And if you say I come to work in a pharmacy, it's not done. Get an official dress. Be well groomed. Dress for the guys. You don't leave your beard without trimming. You don't leave your hair. You don't wear jeans or tofista as they used to call it and t-shirt. No, it's not done. You wear a proper shirt. You tuck in. If possible, you wear your flying tie. You wear your white overall. Your shoes are polished. Your hair is done. That is good. All right. And this you send an impression to the patient that you are serious to work. Another one is what we call sexual awareness. Sexual awareness is everybody has gotten his personal space, all right, and people normally don't want you to invade their personal space. Now, this one could be cultural, by the way. But in some cultures, too much separation between interacting individuals is viewed as insulting or dismissive. For example, if a patient comes to your pharmacy and the distance between you and her is so big, obviously, I know because of COVID, okay, patients are not getting closer to us again. But initially, we would like them to get. However, we don't want to get too close to the patient. The patient may feel you are invading his or her personal space. That's what we call sexual awareness. So when I'm talking to somebody, if you want to get closer to the person, okay, we normally will ask them, Madam, sir, please, can I get closer? I want to check your blood pressure. Can I come closer before you go there? Okay. If you're not asking this and tells them you are rude. Okay, but anytime you are getting closer to a patient, you want to check their blood pressure, you want to check their blood sugar, you want to have a conversation with them, you ask their permission for them to okay you before you invade their personal space. This is called sexual awareness. Another thing that is very important too when we are talking is our tone of voice. Okay, use of the correct tone of voice in all situations with patients and customers cannot be emphasized enough. All people respond more favorably when spoken to in a tone that makes them feel respected, cared for, and understood. Your voice should convey an attitude of helpfulness and respect. Okay, you should reflect positive feelings about your job, your patients, and their skills. Okay, the sound of your voice should always remain calm, confident, and respectful. Medicine counter assistants should be aware of their vocal tone and never sound sarcastic, impatient, bored, parental, bullying, weak, or hesitant. All right. So when somebody is buying something and is asking a question and you are stammering, um, okay, that is you are hesitating, and normally they will not take your word for anything. Another one too is posture. Okay, and there are two main postures we talking about: an open and closed posture. So posture is the position of the body respect the surrounding space. Okay, if you look at this lady, the one sitting on my extreme right has gotten a perfect posture for a job interview. Assuming you're going for an interview, this posture, the first three counting from left down to the right, obviously is going to discourage the interviewer. Okay, so posture is the position of the body with respect to the surrounding space, as we said. A posture is determined and maintained by coordination of the various muscles that move the limbs by the sense of balance. Now, during communication, posture can usually be described, as I said, open and closed. And in open posture, the position of the body with respect to the surrounding space, okay, normally shows a feeling of receptiveness and friendliness. And we'll be seeing some pictures very soon. All right. So an open posture position consists of the arms lying comfortably at the sides on your laps. One should face the person to whom one is speaking and lean forward to indicate interest in what is being said. Okay. All of these actions signify that one is listening and demonstrate positive forms of communication. Now let's look at this posture. Now this young lady, for a doctor, you can see is her posture. She's leaning forward. She's not lying back in the chair. She has pushed slightly forward towards the patient. Her eye is maintained. Her facial expression is fine. Her arms is on her laps, and can see she's even taking notes while she's listening. This person is serious, and the patient is going to take you serious. That's a perfect open body posture. Okay. Now with this nurse and with the patient, okay, that's good for me. communication. The healthcare assistant's body posture is open and friendly. Okay, you can see that they are maintaining, pointing and speaking. Okay, and they are talking about something on their mind, and that is good. This is also another good, maintaining eye contact. I can see the patient is smiling. Okay, and the good communication skills is being showed. Okay, so here when the patient is sitting, you sit. When the patient is standing, you stand. All right. So initially, this person you can see was standing. Now just sat at the same level with the patient. Okay, in communicating, maintaining eye contact. You can see his hands are on it. He's also leaning forward towards the patient while they are engaged. When you talk about sexual awareness, look at the distance between the two of them. That is perfect. All right, he's not too far, not too close. All right, and that's excellent for communication. Okay, this is another one. You can see key learning point. Our body language says a lot about our interest and engagement in the communication we are having. All right, so this is a beautiful picture, and you can see they are open. We have another one that we call a closed body posture. Okay, now a closed one conveys the opposite of the open one. Okay, a feeling of not being totally receptive to what is being said. So a person in a closed posture may hold the arms rigidly or folded across the chest. This person may lean back in a chair, away from the person, or may tend to avoid eye contact. Slouching is a kind of closed posture that can convey fatigue or a lack of caring. So when you look at these various postures, okay, look at the posture of the patient. Okay, it's showing us this person is not looking at the patient now. His eyes are turned away from the patient. Okay, now his arms are folded. You can see this one is also negative. We don't do that when you are speaking with the patient. Okay, even though he's maintaining eye contact, the arms are folded, and that's a negative posture he's using. Okay, this one too is another one that's very, very negative. Okay, now this person, if you look at the face and what they are doing, what type of message is he communicating? He doesn't look happy. Okay, and that is very bad. The next one is physical contact. It is important that touching can be extremely powerful tool for medical professionals when utilized appropriately and therapeutically. Now, the boundary between appropriate and inappropriate touching is well defined and inviolable, okay, without grave repercussions. On the other hand, one must also be aware of the proper use of appropriate touching in the workplace. What we are saying is simple. If you're a guy and touching a lady, the lady may think that you are interested in her. Okay, so that's why I say there's a thin line between the two. Touching another without his or her permission is never acceptable, and it is essential that the MC understand that the different forms of consent that may be offered or denied other than verbally. All right. So here, if you want to touch anybody, ask of their because sometimes a patient comes and they are telling something, they are crying during counseling sessions. Okay, just by holding their hands, telling them that you empathize, you understand. Okay, you try to understand what they are going through. May console the patient a lot. Okay, so occasionally the MCA might require to demonstrate proper use of an application of prescribed treatment. It is, however, important to ask permission or explain the necessity of any procedure that requires a hands-on approach before acting. The mere act of asking permission imparts respect and facilitates cooperation. Just by telling the patient that based on this procedure, can I hold you, can I hug you, can I touch you because I think you need it. When I'm checking somebody's blood sugar or blood pressure, obviously you have to touch them, you have to hold their hands. Okay, when somebody can say, oh, my ankle is hurting and I want to examine, I wear gloves and I have to touch them. But I'm saying before you touch them, you ask of their permission. Okay, once they grant the permission, before you do this one tells the patient you respect them and it facilitates them to cooperate with you. It also creates an atmosphere of safety and comfort. Sometimes the patient doesn't feel comfortable and they have come with somebody, a relative or a friend. I ask them to be present whilst I do the examination. Okay, so this is a perfect example of touch when you are taking the blood pressure. And this one let the patient know that he or she is welcome to the pharmacy. This one is another doctor consoling the patient, and it's good that when somebody is diagnosed with diabetes or hypertension, okay, we have some time with them and let them know that it's going to be okay. That is very good. Okay, and this one is where the patient is having a back pain, and here the person is examining and holding. and the patient feel more comfortable and confident when this is being done. All right, so this is the end of our part 2. Okay, it's quite a lengthy lecture. I'll be coming the last part, that will be the part 3, possibly God willing, on our next meeting. And we have learned today the two main types of communication, the verbal communication and the non-verbal communication. I've said that for us to make a big impact, we should combine the two, both the verbal and the non-verbal, in all that we do. Please send me an email on my MacBook 4 to know that you have listened to the lecture. At the end of the communication lecture, at the end of the next lecture, which will be the part 3, there will be a quiz on our platform, okay, online quiz. There'll be a long quiz that I recommend that all of you take it. God bless you and see you for our next lecture. All right, bye bye.